am Dr. Gumadavelli Srinivas from Telangana, Hyderabad, South India. So I am an fifth generation of Ayurvedic doctor. So I am practicing more than 36 years. So in my family, total our mom and grandma. So all of the persons having the Ayurvedic knowledge. So I am requesting all of you people. So Ayurveda is the Vedic life or Vedic science. Born in India. So our bad luck, so many wars are there. So our knowledge has gone through out of in India. So that's why so much knowledge is destroyed by another persons. Nowadays there is no particular and important knowledge is very much having very so much hard to find out. So in our India, Varnashrama Dharma is there. That is Brahmana, Kshatriya, Vaishya and Shudra. In olden days, the Brahmana having the capacity to teach and to treat all people. So after coming long, so we have to convert so many modern systems or Western systems. So much problems are there nowadays. So we thought that the Ayurveda is now secret. So now that is what secret. So this knowledge has kitchen knowledge. Actually, we are having so much kitchen in ingredients. We have to stop. So already I have started Dinacharya and Rutucharya. What you call Dinacharya means every day we have to do and what to do not. So every man having three dosha, Vata, Pitta, Kapha dominated. Means Vata Prakriti persons, Pitta Prakriti persons and Kapha Prakriti persons. So the public have to know what their Prakriti. According to their Prakriti, they are having so much limitations to eat and to move the every daily life. So that's why we are requesting all people to know Vata, Pitta, Kapha of their Prakriti and Rasa, Guna, Virya, Vipaka and Prabhava of all food pots, food materials, those who are eating rice, dal, sabjis and so much wheat. So we don't know what we have to eat, what we are eating. Some people having the allergy to gluten. Some people having allergy to tamarind. Some people having allergy to citrus. So they don't know. So that's why we have to know the knowledge. So that's in this manner we tried one institution, that is Bhagavan Dhanvantari Ayurveda Shiksha Pratishthan. So Bhagavan Dhanvantari Ayurveda Shiksha Pratishthan already having some batches to know the knowledge of our secret Ayurveda. So Ayurveda having Ashtanga means 8 departments of Ayurveda departments. So only government has giving knowledge of Ayurveda only, but people have more and more requirement is there. So we conducting some special program for free learning Ayurveda camp. Free learning Ayurveda camp. In this camp, Ayurveda having more than 64 varieties of different kind of knowledge. Suppose you take acupressure, acupuncture, auriculotherapy, marma therapy, naturopathy, sujok, so many yoga, what do you call panchakarma, leech therapy and kshara sutra, kshara karma. So many departments are developed earlier now. So we have to know this knowledge. We are doing that 64 kinds of departments. We are giving this knowledge. Those who are practicing Ayurvedic knowledge and to know their healthy life, to fit their healthy life, and to promote their family members and neighbors. So please welcome to our camp. This is free camp. There is no fees for accommodation, food and material, and we are developed so much different kind of directive practical. We show you all herbs every daily life we are using that herbs, and how to make chutneys or how to make curries, means sabjis, what to eat, what to not eat. Suppose samskara viruddha is there, or so many viruddhas are there. Suppose all people are taking curd in the night. Suppose Shastra says na naktam dadi bunjitaha, means na means no, naktam means naktam means night, dadi means curd, bunjita means eating. So no eating curd in the night. But all people, public are taking in the night curd only. So this is the dangerous for their life. And Ayurveda says no milk with salt. So this is the different kind of dangerous for them. But people are taking salt with milk, and they are heating honey, or some people having warm water with honey. So much they don't know. So in this camp we have to train all together 64 varieties of different kinds of departments in related with Ayurveda freely. So please welcome to all. There is no age limit, and there is no educational limit. Just you have to have interest in the Vedic sciences. Hare Krishna. Yeah. So Gavo Vishwasya Mataraha. So our mother cow is the mother of universe. So we can tell the mother is having 33 crores of demigods. So in that side the Lakshmi is there. So we are using all the cow products, that is milk, curd and cream, means cheese, butter, so many things, and lastly ghee also. So we are having so many cups of ghee, Sahiwal, Red Sindhi, and local breed our Ungol. So the urine with all medical values alone only, so many properties are there, and along with Arka we are having lot of preparations are there. So we are using for cancer patients, for Kapila Go. This is Swarna Kapila. This is Gir Swarna Kapila. We are using different kinds of diseases, just like gallbladder stones. For this Ark is very good for gallbladder stones, and liver cancers. So much use for liver cancers for this, especially this urine. So Goarka is having the Ushnavirya Lakshana. You know Ushnavirya and Shitavirya. So Ushnavirya means just like Pitta Vardaka. Those who are having Vata and Kapha in nature, we have to use Pitta Vardaka. So many cases are having, all cancer patients are having Kapha domination. Suppose we have to use Pitta Vardaka Goarka. Along with so many medical herbs, we are using along with Arka. That is called as Arka with another properties of medical value. And milk is the A2 milk is there in our India. So much A2 milk people, so having lot of energy. So Sattva Guna. So with the A2 milk, we are having so much Brahminical culture we are developed. We are using milk, buttermilk, and ghee. So we are using with after curdling of milk, we prepare ghee. Yeah. So cow urine is having Vyavayi and Vikashi guna. That is called as Vyavayi. The medical herb takes alone. You are saying that Amruta, that is Guduchi, Phenosphoria cardifolia. We are using so many immunity disorders cases like HIV and cancer patients, Jirna Jara, so many long lasting fevers, and that is a Pitta Leda or what you call Tridosha Shamaka. So if we take individually, the person has to digest medicine, but we prepare along with ghee or arka, means urine. This may contains very effective to the part. The urine it take directly medicines to the affected cells. That is the difference of arka. So we prepare along with so many medicines, more than 60 varieties.
I heard that some Vaidya told me, when you medicate a herb with cow urine, that the power of that herb increases by 6 times.
Yeah.
How that happens?
Yeah, that efficacy means rasa, guna, virya, vipaka and prabhava. The mixing with or preparing with go arka, it may fortify their prabhava. Shastra says already Goarka is having Ushna Virya Lakshana. So all varieties of cows are having a different variety of prabhava of their earth. Suppose we take black colored cow is different, is white colored cow, and moreover the young cow is having different urine, and the pregnant to take pregnant cow urine is different. No, there are many types of making herbal ghee. First of all, we making kashaya preparation. Once we take different kinds of herbs along with kashaya, we have to prepare kashaya. After preparation of kashaya, we put together ghee and kashaya. We have to boil it. After the boiling point of water is 100 degrees centigrade, so ghee boiling point is the 300, more than 300 degrees centigrade. So the water will evaporate. The whole medical herbs are in that active principles goes to ghee. That's why the ghee also having medicated properties. So we preparing kashaya preparations.
In the kasaya, how do you exactly make a kasaya out of a herb?
So we take wet or dry herb. We put together, all are pounded little bit.
Powder it.
Powder it or pounded.
Yeah.
So and next.
Oxygen.
So we make suppose 10 liters of water, suppose 1 kg of herbal powder. We mix together and boiling, simple boiling method. And after boiling, so the dravya means the decoction will 1/4 of 10 liters means 2.5 liter. After we filter it, that is called as kashaya. After completion of kashaya, and we take suppose
Basically, you're concentrating 10 liters of water and to 1 kilo of powder.
yeah
And it becomes 2.5 kilos of liquid kasaya.
yeah.
Okay, and then?
So and then again we put together ghee and kashaya. We simply boiling along with ghee
How
and
much ghee?
kashaya. Ghee we take 1 liter.
So again, 1 liter of herb, 1 liter of ghee, and this water and
2.5 liter of
again you boil it.
yes, again boil. After completion of boiling, so there is no water concentration in that ghee. So that is the medicated ghee.
Wow, it's an interesting way of doing it. And it has to be deshi ghee, no?
Only ghee means the deshi ghee only. There is no another ghee.
Means deshi bhash is also A2, that's what I was.
Okay, but bhens means buffalo having madakari or tamoguna, but mother cow having sattva guna means Brahminical culture. So ghee means the evolution of our brain, so our capacity. But buffalo ghee having tamoguna and having rajoguna.
Also, I want to know about diseases like Down syndrome, where the genes are tripling.
Yeah.
So this kind of disease, how do you treat with Ayurveda? Is there any cure for this?
No, actually, Down syndrome is having a genetical disorder.
Yes.
So we can give panchakarma treatment along with vata shamana dravyas.
Okay.
So we can treat Down syndrome.
But is there any case known to you who a Down syndrome patient is normal?
Yeah.
Really?
Real. We have so
Wow.
many multiple sclerosis cases, Down syndrome cases.
Cured completely and they are now working normally?
Not cured, but they are maintaining their
50%.
life. Yeah,
50%.
they have to maintain their lives. No problem.
They're like normal people.
Yeah.
Wow. Amazing. And cerebral palsy, how do you treat that?
Cerebral palsy, that is a vata disease. We can treat simple. That is
Really?
Yeah.
And how do you deal with the kids? Because kids have this disease, no, in the beginning.
Kids are now they are having autism. That is the most important disease nowadays. That is autism. For autism, we put 8 drops of medicated ghee
In the nose.
or Brahmi Kruta every day nose, and every day we are giving 5 grams of medicated ghee, that is called as Manduka Parni or Pushni Parni. So Centinella asiatica, Hydrocotyl vulgaris. So many Brahmi drugs are there. We are having a Brahmi Kruta.
Have you cured autism cases in your locality?
Yeah, yes. I am dealing with autism children also now. So I am sending medicines to abroad, US also. Yes.
Amazing.
Yes, we are having autism cases.
How much time it takes for autism to cure?
So we can treat minimum 6 months, and special training for children and mother and parents also.
So they should meet you, right?
So for autism cases, we give Satvika Ahara. That is the most important. Satvika Ahara means very bland diet, no spicy.
Amazing. What other complicated cases we have seen cured in Ayurveda and not in allopathy?
So we are having different kinds of chronic cases like cancer patients. Now we are, I am having so many cancer patients now. So earlier liver cancer is there.
Liver cirrhosis?
Yes, not liver cancer.
Okay.
Liver cancer patient.
How do you treat that? With cow dung or with the cow urine?
No, I use cow urine with along with another herbs. The cow urine is main ingredient.
And medicated one?
So cow urine is medicated along with herbs. Now,
Which herb you put?
so many, Vinca rosea.
In Hindi?
Vinca rosea roots. Rosemary roots.
Rosemary also.
Rosemary
Roots.
roots.
Okay.
Rosemary. So many grasses are there. For cancer, so many drugs are there in Ayurveda.
But you prepare as per the customer, or it's already always you have stock of this
No,
medicine?
Our motto is after seeing patient only we can prepare.
Oh.
Not having
Oh.
medicine.
So two patients with the same disease might have little different combination. You meant to
They
say?
are having vata, pitta, kapha in nature. Suppose one patient having pitta domination. Suppose one patient is vata. So their disease are also having vata, pitta, kapha. So according to their nadi pariksha we can do.
If there is no possibility of Nadi Pariksha, what are the other options we can choose?
We can take their biography.
What is that?
Means biography means
Symptoms.
symptoms, darshana, sparshana, prashnaitacha. So darshana means we have to see, sparshana means we have to auscultate our nadi pariksha, that comes ashtavida pariksha or trivida pariksha. So prashnecha means interrogation.
Okay, another thing I want to ask you, sir. When the students will learn from you all these different kinds of science,
Yeah.
and what I see here is that you have experience, and more experience, there is accuracy due to the experience. Now, how a new student can achieve that kind of accuracy and do this kind of complicated cases?
Earlierly, they don't take
It's complicated.
complicated. So the guidelines with their guru, they can treat. So the presentation is most important. So the characters of patient is most important. They have to take all kinds of testimonials, reports. We can take. But earlierly, the students may not go for complicated cases. So Ayurveda says. So that is called as parivarjana. Suppose one patient having Indriya Lakshana, Indriya Sthana. Indriya Sthana means the Charka Indriya Sthana says one patient having ready to go to die. So please leave that patient. Otherwise you punish. Ashtanga Sangraha says and Charka Indriya Sthana says. That's why don't take that kind of very difficult case.
Oh, so if somebody is going to die, you should not help him.
No.
I'm doing it all the time. So there's a path karma in that?
Yes, pop karma and already the nature is going picking. So why we go for the opposite for nature?
But what if we have a certain cure for it? Like if you know the exact recipe to give and can be cured,
Yeah.
then we should not take that?
Oh, for that case,
It's a complicated case, but you know a certain cure
yeah.
and you have the recipe ready, so can we give them or not give
Yes,
them?
we can give, but the assurance of the assistants of or attenders of or relatives of the patient, we have to take assurance from relatives. Otherwise, they can create complication. So that is the most important also.
Yes. We're going around in our Goshala, French Goshala, and we're checking out all the weeds and herbs and trying to figure out if they are useful in our medication. Here we are just going on a patch, figuring out some. Okay, here is one small plant. What is this called?
This is a Philanthus neruri.
Okay.
Philanthus neruri is having better for antibacterial and antiviral activity. Suppose now our Telangana and Andhra, most of the people having viral fevers and hay fever or rheumatic fever For fevers, it can be helps more. Please take up to 100 ml of this
Kada.
direct swarasa, means total juice of this
Leaf.
So it can be cured up to 2-3 days. It can be cured. So this is another property is there, that is the liver cirrhosis, all kinds of liver disorders like jaundice.
Can be cured with this. Huh?
Yeah. You can take every day 100 ml, morning empty stomach, along with adraka swarasa. Means adraka swarasa means ginger. You can take along with the ginger spoon. It's a very good properties.
Amazing.
Amazing.
We'll take another.
Not just now. No, Bala is good, but not here.
Huh? Cow may be evident.
It's not there. This is a Tridax procumbens.
Okay.
It is very good antibacterial activity. Suppose one patient or some person having direct wound or some accident, it can be cured immediately 2-3 days only. This is a very good for external use. You have to take simple 10 to 15 leaves or total. It has to be crushed and take juice along with some sterile pad. We have to put and tie. After 2-3 days, it will be gone.
Great.
Only one hand is there.
I said this is land this for cultivation. No, that's why the herbs are not there.
Yeah.
Maybe in that one is being there.
Oh, Bala is there.
Bala, show me the book. Bala.
Yeah, Bala. Sida cardifolia. The scientific name is Sida cardifolia. We take roots only. This is an amazing plant. So those who are having very serious illness after completion of illness, these Bala roots may cause having tonicity. So this is very good for tonicity, means tonic means energy. In any having suppose arthritic pains, knee pains, or amavata means uric acid levels are high. You have to take this root only and boil it, and you can take every day or 100 ml of decoction every day up to 1 month. It can be cured. So this is the Bala root. This is the Indian ginseng also.
Oh, ginseng, Indian ginseng.
Yeah, this is the Indian ginseng.
Mind it, we are not in a herbal field, it's just a field, cultivated field where these things are considered as weed, but actually they are herbs.
There and next you can show this plant.
Yeah.
This is another Bala. This is Ati Bala. In Telangana, Chitta Mutti. This is also same properties. We are using for Bala Rishta, Bala Churna.
What disease can you call? Same disease?
Same tonic.
Amazing.
This is also same having Indian ginseng properties.
Only cultivated, no? It seems like not be cultivated. Got hurt?
There is a.
Let's go back then. I don't think there is anything else.
This is the karanja. You know karanja?
Yeah, Karanja is very famous for something. Huh? It is used for what?
So karanja for anti-cancerous agent. Anti-cancerous
So 100
agent.
ml of juice of this also you can take.
So, huh?
You have to take what, powder or juice?
No, direct decoction. Decoction in the sense simple. You take 6 to 7
Leaves.
leaves, put into 100 ml, 200 ml of water. Up to that will be off. But you have to take after filter. You take every day fresh. No disease will come.
Wow. Should have herbal tea of Karanja then.
Yeah.
Kada herbal tea. What is this?
This is one kind of runner where we are using for liver cirrhosis and liver disorders. It can be taken directly.
Leave as a leaf.
As it is.